How many of you out there are finding that when you're typing, you're cramping up and your fingers are cramping up? We've got a great finger dexterity training coming up. Stay tuned. So you're looking for another finger exercise that's going to help get you stronger, get your ability to type without cramping or that aches and pains that you're getting in between every digit. I know some of you know what I'm talking about. So all you need is to find yourself a golf ball. You can go to your sporting goods stores. And what we're really trying to do is you're trying to really enhance the ability to roll every digit, try to get all the way through and then push it out. You don't want any shakes. You don't want anything to like skip a beat. You just really want to be able to pull through and push it out. Pull through, push it out. Now you should be able to do it every digit. Now I had a mallet finger and you can see what really goes off. You can see that digit right there. It does like a hyperextension. So I really need to work on this one, especially as a manual therapist. But you can see that that's ideal. So you should be able to do them all. Now if you want to make it a little tougher, of course, you upgrade to something bigger. You can find these at the pet stores. And then obviously another bigger one, but oops. There we go. And so here. All right, there you go. And that's the exercise. So there you have it. You've got all these different size balls you can go find at sporting goods stores or pet stores. Just give it a shot. You want to be able to continuously roll the balls, back and forth and train those little muscles that we all need and we use every day. Make sure this is the right exercise for you and you've checked with your healthcare practitioner. If you like what we're doing, please subscribe below, leave a like, any comments would be great. And if you really need to get a hold of us, you can email us at rehabandrevivemedia@gmail.com. I'm Dr. Lynn of Rehab and Revive. Remember, we heal smarter, not harder.